What's up, y'all? How are
Happy
y'all
New
doing?
Year.
Hey, Happy New Year. Happy New Year 2026 is here. Super excited to be here, of course. Starting a new year off right here at the Cowboy and the Queen of Aesthetics. And today we're going to be saying like how PBM works beyond the skin, right? People think PBM is just for the skin, that it stops at the surface, but also Missy, what is PBM? And Happy New Year to you, darling.
Happy New Year. We have lots to talk about, and this just happens to be one of my hot buttons. I love photobiomodulation, and I'll tell you a little story later on. I think it saved my son's life, and so I'm very passionate about it. But PBM, and that's what you'll kind of hear it called in the marketplace, is PBM, which stands for photobiomodulation. So photobiomodulation enhances biological functioning in the body. And so what it does is it helps cellular energy production by increasing mitochondrial functioning within the cell. And so, what that does essentially is it helps the body heal from within. And so, you can do everything from wound healing, it can help muscle and tissues in the body, it can help with pain relief. It also helps with chronic pain, injury, chronic inflammation. And it also has anti aging benefits as well because it produces collagen and elastin. And it also serves as neuroprotection. So, whether a patient has suffered from a traumatic brain injury, which my son did, or a concussion, or has a functional neurological disorder, or even treating issues like PTSD, anxiety, depression, it helps support brain health. So, photobiomodulation is not just for the skin at all.
That's crazy. I know. And I'm super excited to learn more about this because, like you said, there's so many benefits to this. And, if you can kind of walk us through how, the wavelength changes the penetration or so forth. If you can, you kind of explain it a little bit.
Light in the red spectrum is roughly between 630 nanometers and 660 nanometers. And so that is what primarily targets the skin and the superficial dermis. So, and when you're dealing with lights in those spectrums, it improves
Yeah.
keratinocyte turnover, capillary flow, and superficial collagen remodeling. It can be something that's just skin deep, but we know that different wavelengths of light and spectrums of light, we can actually penetrate much deeper than just skin deep.
And like I said, at near infrared.
So there's red light and then there's
Okay.
near infrared wavelengths. And those wavelengths are different. Those are 810 to about 880 nanometers. And those penetrate deeper. So those can penetrate things like the fascia, muscle tissue. Those help with lymphatics, even joint pain, depending on the tissue density.
Okay. So that's how PBM like works with like muscle recovery, inflammation, pain, and so forth, correct?
Right. So it's not just cosmetic. It's really cellular medicine, if you will. So the broader the spectrums of light, the more symptoms we can treat. And so with true photobiomodulation, we have many more spectrums ranging from 525 nanometers to 1060 nanometers. And now we're even going a little bit deeper based on the newer research that's come out in the last 10 years. But what used to be just reserved for superficial healing now goes much deeper.
So what about, I mean, people, because people do talk about this, like people talk about the pulse width. Can they talk to me a little bit more about that?
Right. So pulse width is hugely important. And so pulse width controls how mitochondrial receive the photons. And so continuous wave delivery can cause actually photothermal buildup. While if you have micropulses of delivery, this allows the mitochondrial respiratory chains to rest in between those bursts. So it's healthier and it's more effective if you don't have just constant width, but you have actual pulse width control.
So you can avoid like cellular fatigue, correct?
Yes. So pulsed photobiomodulation maintains the mitochondrial responsiveness, and then it prevents that overstimulation of the cell.
Okay, that makes sense. So what happens after though the mitochondria are stimulated, if you will?
So the mitochondrial production or mitochondrial stimulation actually causes a mitochondrial cascade. And so what you get is an increased ATP production, which is energy within the cell. And what this does is it reduces the nitric oxide inhibition, which improves membrane potential. and this altered genetic expression through transcription, like NF kappa B and NRF. So, what we want is we get that systemic mitochondrial cascade from um, from the mitochondrial being stimulated.
So it doesn't stop where the light hits, correct? Or
Not at
okay,
all, not
okay.
at all. So, photobiomodulation initiates systemic anti-inflammatory signaling through circulating that cytokine modulation. And so, it's important that we know that it's not just surface, and we can't make medical claims, right? So, we can't say it's going to cure something, even dealing with skin and collagen and elastin production. But in our practice, we've treated many functional neurological disorders, PTSD, anxiety, depression, ADHD. I mean, we treat the symptoms of many of these disease states because it's not just skin deep any longer, but it does have the potential to go much deeper inside the body.
And that's the next question. How does it do that?
So, near infrared PBM affects the red blood cell deformability, and it improves oxygen delivery and enhances lymphatic flow. And once those systems are activated, the benefits spread far beyond the treatment site. So, like I said, when we're looking at a photobiomodulation, it's usually a bed. In our practice, we have a bed that it looks similar to a tanning bed, if you will. And
Hmm.
there's lights on the top and on the bottom. And we know the light penetration is equal distance when the person lies in the middle of the bed. So, because these treatments are typically in a bed form, we know that we don't just have to treat the treatment site, but if the mitochondria is affected on the entire body, then inflammation overall can be reduced, or the mitochondrial functioning overall in the body can be reduced. So you don't just have to like spot treat if you have a hurt shoulder. You can reduce overall inflammation, or just, by treating the entire body, if you will.
Okay. And so this pretty much explains why like red light bars don't get the same results, correct? And that
Absolutely not. So most bars lack improper irradiance. And irradiance means that that the pulse width is not controlled. The amount of light that actually penetrates into the tissue isn't controlled. And if that doesn't happen, then, a therapeutic fluence and depth won't be achieved. And so then those are considered just like foo-foo lights or cosmetic lights, but they're not photomedicine at that point.
exact. So yeah, so PBM, isn't just about the glow or whatnot. It's more about the signaling, right?
Right. So when wavelength and pulse width and dose are aligned, photobiomodulation because it becomes a systemic mitochondrial therapy, not just skin deep or skincare, if you will. And so, like I said before, in our practice, we treat the symptoms of many different disease states. And those range anywhere from, ADHD to PTSD to chronic inflammation. And the reason that I am so passionate about photobiomodulation is because my son suffered a traumatic brain injury from being hit with a baseball on third base. And what I noticed after he suffered a concussion was about 3 weeks later, his personality started to change. And he, at the time, was far too young for hormones to be playing a factor in the things that we were seeing with my son. But he became much more withdrawn and depressed, and just wasn't himself. And so pharmacologically, I was really kind of boxed in and didn't have many options to treat him, because someone that is depressed and has anxiety, and he also has ADHD just from birth, you don't know where he gets that from. But I was looking for something to outside of the box to actually help heal his brain. And when I realized that the frontal cortex had, just sustained um, a longer term injury, then I knew that I needed to reach out and seek out something that would help restore the mitochondrial functioning and help heal him without using medication. And so light therapy literally saved his life. And so he noticed a difference after about 2 to 3 sessions, that he wasn't
Wow.
as depressed and anxious. And I, to this day, believe photobiomodulation is the future of medicine for sure.
That's incredible because I mean, this is a true story. I mean, this is your son. I mean, I know there's a lot of viewers that are probably asking too, and I don't know if you can answer this question as far as like, you know, How many sessions does someone need to do? How many times a month do they need to do this to where they can actually see the benefits of this from what your experience and what you
So ideally, when we treat someone with photobiomodulation, we treat them 3 times a week at about a 20-minute session. And so that is where we're going to see the quickest, most sustainable results with photobiomodulation. And depending on what we're treating, for example, if we have a patient that we're treating for a functional neurological disorder, then we would have them come and be treated intensive treatment for 4 to 6 weeks. And we would see that patient about 3 times a week, twice minimally. And that's where we really can notice those cognitive function changes pretty quickly. And the cool thing about photobiomodulation is that once a patient is treated, if they don't see results after their first or second or third session, because we're monitoring that, then we can actually adjust their pulse widths, we can adjust the wavelengths. And so we can really tailor it and customize it because we want the patient to actually feel those results pretty quickly. And so it's something that we can tailor pretty easily, and it's obvious if it's working or not. It's not some sort of voodoo medicine where
Mhm.
we're going, well, maybe we think we see a difference. But when we literally have patients that come in that can't hold food on their forks, right? Because they shake so badly, or they can't stand on one leg to put their pants on. They've lost a bunch of weight because they can't eat, and that leads to depression, and then they can't sleep. These are all measurable things. And so I will tell you, I had a patient that I was treated last year, and about the third week in, they had to run a VRBO here in Houston. They're from Oklahoma. And they found us, on the internet. I know his wife, but she didn't know that we were doing photobiomodulation. And so when I told her that, it was a passion project of mine and that we've been working on photobiomodulation for a couple of years now, they agreed to come to Houston and have 6 weeks of intensive therapy because they were out of going to, they were out of
Yeah.
doctor shopping. Nothing was helping. And so he was diagnosed with something called functional neurologic disorder, or FND. And that's pretty much like saying someone has fibromyalgia of the brain, which just they lump a bunch of, based on their symptoms, they lump a bunch of symptoms into one category and go, well, we don't really know what it is. So we're just going to throw this label on it. And so he was having trouble speaking. He was having trouble eating. He was having trouble dressing. And so about the third week into his session, and we were monitoring him every day, he said, there's a couple of things that have really changed in the last couple of weeks. And he said, I'm happy, I'm horny, and I'm hungry. And that was a very powerful statement to me because he was happy because he was able to sleep and have a conversation with his wife. He was horny because he felt like himself again and he was sleeping and he was getting some of his independence back. He didn't have to have assistance putting on his pants, right? He didn't have to have his wife help dress him. And hungry because he could actually hold food on his fork to eat. And so he wanted to eat more because what you'll notice is when these things start to happen to people, they start to shrink to fit into that space. And so if we can treat those types of symptoms and improve someone's quality of life in that regard without using medications that have horrible side effects,
Right.
then we win every single time. And so I really think that, you're going to see photobiomodulation kind of as a mainstay in the regenerative space. And we're really getting into now the last 10 years of data. And we've really been studying the last 10 years of data. And there's thousands of research papers that have been done on photobiomodulation. And so this is not something that I've researched, but it's something that I've stood on the shoulders of giants and really looked at all the research that have been done by others. And so we're really going to see in the next 2 to 5 years, a huge uptick in photobiomodulation and further advancements in how we're treating patients with even more spectrums of light. And that's going to be based and kind of bridge the gap on all the devices that are currently on the market and the data that's been done in the last 10 years. And so you're really going to see even further advancements with photobiomodulation therapy. And I am 150% here for it. I try to do photobiomodulation 2 to 3 times a week myself. I am very anxious and I have ADHD, as you can tell. And so I do the settings for to be calm and for clarity. And I do have trouble sleeping sometimes. And I'll also treat my perimenopausal and postmenopausal symptoms with photobiomodulation. So the sky is the limit, and what we can treat is really the limit. And so I think, it really pisses me off when I see these red lights being sold on Instagram or whatever, because I think it does the entire concept a disservice to think that, that is just not the same thing as true photobiomodulation.
No, absolutely. Cause yeah, I had some company reach out to me to promote their product or whatever. I'm like, no, I'm not doing that because I'm not sold on what
Because
y'all
your
are doing.
sister will be very
Yeah,
mad at you.
yes, exactly. And then how old was that gentleman, by the way? And then also, is this something that they have to continue to do the rest of their life? Is this something that where they, is it more of a 3 week, 6 week program? Is it a year program? From what you're gathering, this is just something I think that the viewers would really like to hear.
So, when you're doing an intensive therapy, you do need to do 4 to 6 weeks of treatment, being treated 3 times a week minimally. And then you go on a maintenance therapy, just like with anything else. And so, typically at 6 months, we want the patient to come back for another week of therapy if they don't live in a city and have accessibility to photobiomodulation. And so, the goal, and one of my goals as a nurse practitioner, is to have these centers or facilities all over the United States, because really photobiomodulation to this point has really been only accessible for super wealthy
Right.
professional athletes and
Yeah.
Olympians, right? And so that's just not acceptable. All of our servicemen need photobiomodulation near military bases. We know that it can help with PTSD, it can help with anxiety, it can help with depression, and it can help with chronic inflammation and chronic pain. And so one of my passion is getting this in the hands of our armed forces. And so this needs to be accessible to everyday human beings. And so the goal would be to have, centers in major cities, at least where patients can drive an hour and not have to hop on a plane or drive 5 or 6 hours to come see me. There are a
Right.
couple of photobiomodulation pods throughout the United States, but it's not something that you will see everywhere, unfortunately. But that's the goal, and that's kind of where, I'm headed with one of the businesses that we're creating and working on right now is to bring this to more of everyday people like you and I. And I will tell you, one of the powerful things about light therapy is about 2 years ago at the Olympics, they were trying to make photobiomodulation illegal. And that means it's doing something to enhance athletes' recovery and also enhance their performance. And the thing with light, and the reason that they weren't able to ban photobiomodulation or make it illegal, is because you cannot measure light in blood. And
Right.
so the beautiful thing is that it's not a medication. And so instead of making it illegal, we should make it accessible,
Right.
right? And I'm not saying that I want the FDA to regulate this, because we all know that when the FDA starts regulating things, that the quality goes down, and then it just kind of it becomes really washed out. And so we want the quality. It will probably always be cash pay, right? But more
Mhm.
accessibility means more affordability, essentially. And so we want this to be a treatment that, is accessible to more people than is right now, and in an affordable way that people can actually afford to do it. But we don't want to, slap a CPT code on it and make it be regulated by an insurance company, because that is a fear of mine. However, we do know that it is effective, super effective. And we are just on the cusp of, I think, where if we had this conversation in 5 years from now, I think it will be something that you see more of, just like when you talk about infrared saunas or plunge pool, cold plunge, right? I want it to be a part of something that is more talked about and that's
Mhm.
more available, just like those types of alternative therapies are.
Yeah, absolutely. And y'all too, y'all that listening too, if y'all have any more any more in-depth questions or things like this, because this is all very interesting, please make sure that, you reach out to me, DM me, DM Missy or whatnot too, because we really do want to answer and help any questions with this because it is truly something that is remarkable. And from what the results that she saw and everything, the bottom line is it works and it works in so many ways, not just
It
one little
works.
thing, you
I mean, and
know?
we've done our research and we now have our second photobiomodulation bed in our practice. And so the cool thing is that, you know, considering that we're currently working on making our own bed, is that we've had different opportunities to look at different technologies and figure out, what we really liked about that previous technology, what worked really well, what didn't work really well, what was cosmetically elegant about it, what sucked about it. But we treat hundreds of patients with photobiomodulation therapy. That is probably the busiest room in my practice. And so
Really?
it helps with so many different things. And we just allow patients to use it while they're numbing for a procedure or if we're running behind schedule in our practice. We do a membership model. And so patients can buy a membership where they have unlimited usage
Hmm.
to the photobiomodulation pod. But we can treat, my son is 10 years old when we started treating him, and he is now 13. So if you're treating younger patients, you just have to adjust the time that those patients
Okay.
are in the bed. And so I've seen it help so many people. Otherwise, I wouldn't be yet on another crazy journey starting another business. So it works. It absolutely works it works stunningly well.
And, is there a lot of training that goes involved with this as well too, as far as, when you're treating your patients and so forth and who,
No,
just
for the opposite, it's super easy. So on most photobiomodulation pods, there are certain protocols that are uploaded already into the system. And so, based on someone's symptoms and based on their patient intake form, if they're coming in to treat, let's say, anxiety, then we have certain protocols to treat anxiety. And then
okay.
after their first or second
Awesome.
session, we're asking them, did you sleep better? Did you have invasive thoughts? Like, tell me about your blood pressure. I mean, there's things we can measure, right? We can measure objective and subjective things with photobiomodulation.
Right.
And
Right.
so it's not voodoo and it's not guesswork and it's not fluffy. It's true science and it's so easy to measure it. Even with like balance testing, rapid eye movement testing, depending on whatever we're treating, there's many tests to show is it being effective. And if it's not, it's real simple to modify their treatment plan.
Right. Exactly. That's incredible. Um, Gosh, this is all like awesome stuff. I'm excited to see all the questions we're going to get from this because, yeah, this is truly something that I see that can help so many people, no matter their age or whatnot, what they're dealing with. Like you're saying, that one gentleman couldn't even barely hold his fork or whatnot, or
No.
just people that are dealing with, sleep issues or all these other things around that it's part of your life that this could really help. This could really
Without
help
medication, right? Without
without
taking another
medication.
pill.
Exactly, no
And then we don't
medication,
have
no
to
pills.
stay in bed with the drug, the pharmaceutical cartel.
Yes, exactly, we're just going to stay way, way far, yeah, exactly, away from that. Well, I think that clears up everything we wanted to go over today, with PBM and so forth. Once again, um, Missy, do you have anything else that you'd like to kinda just, you go over or I guess I should say too, I always like to ask this question too, if our viewers could take maybe 1 or 2 information from this, what would you tell them? Or if they're interested in doing this type of service, what would you, I guess, ask them or to provide for them?
So I think as a consumer, if you're really looking for true photobiomodulation, that you're just aware of the light spectrums that are being used, whether they're red or near infrared, and what wavelengths of light are being used in those beds. Because I think some beds are just red light. And so it's not truly photobiomodulation. So as a consumer, just do your research and be educated on what you're actually paying for, right? And so I would say if you're doing it at your gym that's attached to your gym membership next to the spray tanning booth, it's probably not truly photobiomodulation. It's probably more red light therapy, if even that. And so, I think that we have to make sure that we know what we're getting as a consumer. And because it's something so new to the market, I think we just have to educate people on what that actually means. And so I love this conversation. And I think the more we dive into it, the more we're going to learn and be talking about photobomb modulation
Yes.
for sure.
Yeah. And we're going to be talking more about this for sure because, like you said, the reason we're here is to
Help
educate
people.
and to help people and educate and tell the truth. So, well, y'all, I think this wraps up our podcast here today. Please make sure to follow us, the Cowboy and the Queen of Aesthetics. When you type that in, YouTube, Spotify, YouTube, we're on there. We appreciate y'all. And Happy New Year once again. It's going to be a righteous 2026.
Happy New Year, guys. And we'll see you on the next episode of Cowboy and the Queen of Aesthetics.
Yeehaw. The information shared on this podcast is for educational and informational purposes only and is not intended as medical advice, right? The views expressed are based on personal experience, medical insight, and current research. But they do not replace medical evaluation, diagnosis, or treatment from like your own qualified healthcare provider. Always consult your physician or licensed medical professional before making any changes, whether it's your health, wellness, or medical care.